We are learning how high-profile racial incidents involving violence affect the mental health of Black Americans. A new study finds that Black Americans reported poor mental health in weeks when 2 or more anti-Black incidents occurred, and when national interest surrounding the events was higher. White Americans' mental health was not significantly impacted. Wizdom Powell is director of the Health Disparities Institute at the University of Connecticut, where she is also an associate professor of psychiatry. Good morning to you, Wizdom Powell. It's very good to see you. I think this is...
Good morning.
I think this is a perfect... Good morning. There's a little bit of a delay, so we'll have to work with that. But I think this is a good time to have you here, because I think yesterday during the closing arguments, that tape was played of George Floyd's death, the before, the after, and the during, that I think has been very triggering for a lot of people. And one person said to me, not only is that triggering, but the defense of trying to explain it has also been triggering, to defend that kind of behavior. What do you say to that?
I absolutely agree. The thing about racism in general is that it is a biopsychosocial stressor. And incidents like being in a courtroom and repeating the exposure to those 8 minutes and 46 seconds, and now we know 9 minutes, of George Floyd's demise can be triggering for everyone who is exposed to it. And so there is a consequence of having that be replayed in an open court.
You say, Wizdom, that we pass on trauma from generation to generation. What do you mean?
So, you know, there's new evidence to suggest that not only do we transmit the ways that we cope with stress and trauma across generations, but that we actually embody that stress genetically, and that we can pass that on in our DNA to those in subsequent generations. But here's the other part of it. What it really means is that if we don't do the healing work, the racial healing work now, that generations, our children, their children's children, and their children will have to do the emotional work.
And, you know, I had a friend, because I have to tell you, I'm surprised at myself at how deeply this has affected me. I think that you keep so much in, and then you start talking about it, and before you know, the floodgates are open. And I had a white friend of mine say, you know, how do you feel? I go, not so good. Better question is, how do you feel? So what role do you think white people should be playing at this time?
So first of all, I think that we all have had our breaths collectively stolen by the incidents of racial violence that we're all bearing witness to virtually and directly for those who are actually on scene during the tragic event. So I would say that what you can do now, if you're really wanting to rise up to meet Black, Indigenous, and people of color in this moment, is to act in true allyship. Listen with a third ear. Accept the reality and truths of what people are experiencing without requiring them to explain away or to offer additional context for what they're feeling. Believe people when they tell you they're hurting the first time. That kind of response, legitimating the wounds that we are experiencing in this moment, can go a long way in promoting racial healing, unity, and restorative justice.
I know so many adults are struggling at this time. I can't imagine what it's doing to children. What is the conversation that parents should be having with their children, both Black and white?
I really appreciate this question, because I think that one of the things that we have forgotten about in this moment is the impact of these events on our children. And I would say that each parent has to select a method of talking to their children that resonates with the temperament, the distress tolerance, the emotional capacity of that child. Every child is different in their tolerance for adjusting to and responding to these moments. But here's the thing. We cannot, you know, be vague about events that are happening now with our children. We have to talk to them truthfully with age-appropriate terms, but recognizing that our children are already experiencing it. So we can't hide the truths of what we're experiencing in this moment from them. Be direct, be age-appropriate, be loving, and most of all, listen with a third ear, not only to what children are saying, but how they're externalizing or behaving in this moment.
Yes. That's right. Wizdom, Powell, we thank you so much for your time. May I say your name certainly suits you. Thank you very much. If you or someone you know is seeking mental health resources, you can call the National Alliance on Mental Illness helpline. That number is 1-800-950-6264. I'm going to say it again, 1-800-950-6264. Or in a crisis, please text NAMI to 741-741. And we'll put it on our website, too. Let's go back now to Tony and Anthony in New York.
Yeah, boy, Gayle, it's not just mental health and racism connected. It's also physical health. We're having this conversation a week after the CDC itself declared racism a public health threat. So couldn't be more timely. Gayle, thank you. We'll be joining you later in the hour.